When to reconsider your dental associateship. Hi, I'm Dr. Avi. In this video, I'm going to share with you some tips about when you need to reconsider your associateship. All right, so a little bit about me before we get started. I went to dental school at NYU and I graduated in 2018. After I graduated, I worked in Connecticut in 10 different offices over my first 2 years. You're probably thinking 10 offices in 2 years? Oh my God, that is a lot of offices. Well, guess what? It is. All of them were different learning experiences for me, and I took away something different from each and every one. Some of them were good, some of them not so good. All right, so I'll share a story about one of the offices and how I got fired from my first job. So I graduated, I started working, I'm super excited, super eager to learn, and I get a job where I'm working directly with an owner, and I'm looking to just maximize all the mentorship opportunity that's available for me. So I'm working there for a couple months, and I'm not really that busy. Well, looking back, I realized I wasn't that busy, but at the time, I had no idea. Like I said, I was just out of dental school, so I didn't know what was busy and what was not busy. Because in dental school, we only see like 2 patients a day, so. But anyways, couple months go by and it's my day off and the phone rings. I answer it and it's HR from the practice and they call me to tell me that I am no longer needed at the office and I don't need to come to work tomorrow because they're letting me go. Yeah, I got fired on my day off over the phone. Crazy. A pro tip from me to you is always negotiate some type of notice period in your contract. I made that mistake and this is what happened. So protect yourself. Obviously, that was very traumatizing, but hopefully you can see that after I had several experiences, not all of them just like this, but many of them similar, I have a different perspective on how to view associateships and when you need to know when it's time to get out. All this information I believe is super valuable. That's why I'm trying to give it to you guys in this video today. Okay, so what is an associateship supposed to look like? You should be in a place as an associate where you are empowered to learn and practice dentistry. As an associate, there is no stress of ownership. So you should be able to focus in on the foundations of dentistry. I'm talking about the clinical and leadership skills. These are the things that are going to carry you throughout your entire career. And finally, an associateship should be a positive experience. Let me repeat that. An associateship should be a positive experience. Don't let anyone tell you otherwise. Okay, I believe that there's 3 questions that you have to ask yourself when you are evaluating your associateship. These are very simple but effective. They culminate everything that an associateship should be doing for you. 1, is the pay good? 2, is the office vibe or dynamic good? 3, are you learning anything? So of these 3 questions, if only one of them are happening, the answer is very simple. Leave. Take it from the guy that's been through 10 associateships in his first 2 years out of school. Not every situation is gonna be a good fit for you. That is okay. You have to understand, you're not a bad dentist. Sometimes the actual fit of the office and the way that you practice and the way the owner practices and the patients, like all these variables come into play. And if it doesn't work, it doesn't work. That's okay. Just pick yourself up and move on. Your time is valuable. Don't waste it. Okay, so you asked yourselves those questions and now you're starting to probably think, oh my gosh, does my practice have this? Am I going through this? Before you start making excuses for the owner of the practice, I need you to remember who you are. You took out a $500,000 loan and you bet on yourself. You have the knowledge and ability to treat patients. And most importantly, you are valuable. Just because they're the owner of the practice does not mean they have your best interests in mind. It sounds harsh, but in fact, most dental practice owners are gonna prioritize their practice before they think about you as their associate. That's just how it is sometimes. I personally do not agree with that mindset. I think you need to value every single member of your team, but that's not how everybody thinks. All right, so you have your 3 questions that you gotta ask when you evaluate your associateship. I hope this video helped you in some way. Please drill that like and subscribe button and share this with anybody that you think may benefit from it. If you have any questions about your associateship, please feel free to message me. My Instagram and email are below. I'm more than happy to help. Have a great day.